Thank you, and thanks, Mike. Mike just summarized everything I will say, so we can go very fast and you can ask the questions. But first of all, thanks for being here and thanks for the invitation. And as Mike said, like I was working for several years in Barcelona, working a lot with the European data. So in different European cities, stakeholders, national and local authorities, and also working in Latin America and started to work more in Latin America now. I just wanted to give you a sense of what kind of project we have, how we have different collaborations with the stakeholders, and you can see how all the evidence from the epidemiological studies can be translated to actual action, policy evaluations, policy scenarios, and how we can actually help the decision makers to improve, in this case, the urban environment and the transport policies. So, and the general idea why I started to work on urban settings is because, and maybe this map doesn't show very nicely, but all these dots or these circles are the populations around the urban population around the different continents. And this is what will happen in 2015. And you see that there is cities that just doesn't exist now that will be created there. So the world is urbanized so fast, and the population is grow also very fast, and many migrations from rural to urban is happening. So there are many opportunities to don't make the mistakes that we have done before in other settings and try to create better cities and actually try to improve the current cities. So we have cities like this, Lebanon and Beirut. So you can see here a lot of great areas, concrete, and it also happens in Buenos Aires. This is Argentina. And similar built environment, how it's hard, maybe they don't have a lot of green spaces, but it's good in terms of density. There's a lot of people. There is maybe good connectivity. So there are good and bad things of this kind of design. And a few years ago, we came with this kind of framework. So you can start to thinking in urban and transport policies. And you see here all the policies, how actually the policies change the urban design. Can change walkability, can change density, land use, transport systems, but also modify other factors like the behavior and how do you choose one or other mode of transport, but affect finally some kind of health determinants, air pollution, noise, the accessibility to open space, public space, green spaces, even blue spaces. And all these are connected with health in different stages. Morbidity, so you translate that policies to different steps, and you actually start to have diseases. And you can translate that, depends on the natural history of the disease, to mortality, life expectancy, quality of life, disabilities. So everything is some way interconnected. Any intervention in any of these steps will be modified, increase the risk, or reduce the risk of have some health issues. So I'm starting with air pollution, and this is the map of air pollution. It is actually all the cities around the world that have a fixed monitor for air pollution. And you see these bars are the levels of air pollution in each of those cities. And I wanted to focus more in Europe. We have a lot of fixed monitors, and some places there are very good air quality, and other places we have a very bad quality of air quality. And if you see Latin America, we have few fixed monitors. Now all the cities have a monitoring station to measure their air quality, but some of them have the few of them that actually measure have a very bad air quality. So we have a lot of opportunities here. We know that air pollution is a huge problem, and this is a picture of China, and that could be LA with all these lines for cars. Like they just take this general ideas how to invest in built environment and how to invest in transportation. And they imported the idea to have private cars. But this is, if you can see, this is Mexico City. And Mexico City have a huge problem and have improved a few years ago. Their quality actually was better, but just they build a second line, more space for cars and second floor in the main streets. So they create more space and they attract more trips, and then a car, more kilometers driving, more emissions and more air pollution. And This is Medellin in Colombia. This is the same month, one day and the other. Air pollution is not static. Air pollution is dynamic, and air pollution can go. So if we can stop the source of emissions, we can actually have a very nice place where to live. We normally tend to say, well, if we have a problem and you have a school or a hospital where it's very polluted, several times I have talked with stakeholders, and they told me like the solution is to move the school or move the hospital. And the problem is not the school, the problem is not the hospital, the problem is the traffic. So what you need to do is move the traffic or move the emissions. So not thinking the other way around, because you can have a beautiful place if you actually reduce emissions. And just to put in context, like air pollution is a huge environmental issue, but also in terms of public health goes beyond. So for comparing with other infection diseases like HIV and malaria, that the health burden related with air pollution is very important. And this is one, several years ago, the government of Mexico contacted us and asked us to help to measure what will be the health implication of improvement of air quality in some urban areas in the center of Mexico. This is the Puebla in Mexico, and they wanted to see there will be implemented, they plan to implement some interventions to different set of policies to reduce the air pollution in these areas, and they wanted to see what will be the health implications in terms of morbidity and mortality, but also the costs related to these improvements. So we work with this geographical area with these states, and this is actually what we came. And this is different diseases. This is adults and children, and this is what is the number of cases of deaths that are actually and diseases that can be prevented or avoided or postponed if you remove the air pollution, the exposure. And this is the amount of health that you can win if we can improve the air quality. So this is started to translate all the evidence between all these cohort studies that say there are a relationship between air pollution and different health outcomes, and try to apply it to a real case scenario. We also translated that in health costs, theory health costs, and indirect health costs. Theory health costs, for those that are not familiar with this, economic evaluations are those that are related with the health services, and indirect health costs are those that are related with absence for work. Because you are sick, you cannot go to work, or because your children is sick, you need to stay with them, so you cannot go to work. So this is a combination of health related costs, and you can actually came with a huge number of impacts in the economy. So maybe actually the interventions of improving air quality, they're not only good for health, are actually good for the economy in general. So, and this is a nice picture of Barcelona in Spain, and this is how the city of Barcelona promotes come to the city and visit this really nice place, nice bars, plazas, terrazas, restaurants, the beach. There are a lot of fun activities. We have the sea here, and here this building that we have here, this is actually the building that I was working and I'm still affiliated there. But this is the real Barcelona. The real Barcelona have a lot of this of air pollution. We have a beautiful city, but we have a lot of people, and this is actually the center of the city, and we have more or less around 2.5 million people living in the metropolitan area of Barcelona. Most of the jobs are inside, so many people need to travel and drive to the center of the city, and this means more air pollution. And that's the reason we have these clouds of pollution here. So this is the map, again, of Barcelona. Here is the sea, this side of the mountain, and this map shows you in the darkest area the highest concentration of air pollution. In this case, PM2.5. This is particles that they're in the air, and you can see there are areas in the center of the city that have the highest concentration of this. And this map is the same, Barcelona, but this is in the case in the an index of social deprivation. So here we have how the population is distributed in terms of socioeconomic status, and you can see that actually the lightest areas are where the more wealthy people or the less deprived living. In the case of Barcelona, and happens in few cities in Europe, the wealthier people try to live in the downtown, and it's actually where the air pollution is. So we wanted to see actually what is the distribution of the burden of certain diseases in terms of air pollution, but also how distributed in terms of the socioeconomic status. And for this, we estimated, well, we made some measurements to try to establish what are the current levels of air pollution in Barcelona, try to see what actually recommend the World Health Organization in terms of these levels of air pollution, to try to see what will happen if we improve our air quality to some target, see what is the difference between this exposure, and then try to obtain from these epidemiological studies, some cohort studies, this relationship between these curves that say for each increment of exposure you have an expected impact on the health. So with that, we translated and estimated, well, what is actually the levels of exposure in my population, in this case Barcelona, the current scenario, versus what will happen if we improve the air quality. We estimated the relative risk, the risk of having this kind of a specific disease, and then apply it to the population. And in this case, our focus was on asthma in children, to try to highlight we have a risk perception that the children, maybe we can be exposed to air pollution. We don't see air pollution, and this is the common sense of many, the general public in terms of risk perception of air pollution is not so high. But when you see that you don't want your children to be exposed to air pollution. So we also wanted to highlight that part, to try to attract attention in terms of some specific population on health outcome. What we came is like this is actually the burden related to asthma, related to air pollution, in this case NO2 and particles. And you can see here like around 90% of the cases of asthma in Barcelona can be attributed to air pollution. This is assuming that we can achieve the goals of the WHO, the World Health Organization, in terms of the guideline of air pollution. But actually, many epidemiological studies that study air pollution have measured lower levels of air pollution and have found that even in lower levels of air pollution that they recommended by the WHO, you still have some health implications. So we create a scenario, what will happen if actually we go to below the recommendation of WHO to those levels that they're starting to show that produce some health effects. And you can see here that we estimated around almost 48% of the cases of asthma in Barcelona can be attributed to air pollution. This is a huge amount of cases that can be prevented, avoided with air quality measures, with the transport policies, with the energy policies. And their interventions, they are not associated with public health, but they have a huge benefit in the health sector. We also compare that with different socioeconomical status groups, so the deprivation groups. And what we found, as I show you in the first maps, is that those that are less deprived in Barcelona, that is here, the quartile 1, in the 3 different pollutants, are those that actually have more cases of asthma attributed to air pollution. This has happened the way around, or the other way that happens in the US. The US and North America, Canada, most of the studies show that actually those that are more deprived are those that are more exposed and those that suffer more from air pollution. In this case, Barcelona was actually happening in different way because the distribution of the social groups. So what now we are working is to try to go to lower levels of air pollution, because we identify that with lower levels of air pollution, actually we started to see health implications, and this is a European project that tried to identify more and better exposure assessments and lower levels of air pollution. And this is the map of Europe, and in this case is NO2, and you can see that many of those countries are very blue, and this means that they're very, in terms of this pollutant, low levels of air pollution. So we wanted to see, well, even that we have low levels of air pollution, there are certain areas, mostly urban areas, where we still have a lot of air pollution. And we apply the same idea to what will be the number of cases of asthma in children that we can identify in 18 different European countries if we can achieve the goals of the WHO, but also the lower levels of air pollution. And I just wanted to show you here the last line that is the combined result. And we found like, if you see here, this is the percentage of cases that we can attribute to, this is PM 2.5. If we achieve the goals of WHO in terms of PM 2.5, we can attribute or we can reduce this 11% of asthma cases in children. And this is around 66,000 cases of asthma in these 18 European countries. But what happens if we go below? What happens if we go to lower levels of air pollution? Finally, we estimated that almost 30% of the cases of asthma in these European countries can be attributed to these lower levels of air pollution. So to this exposure to air pollution, assuming this lower level of targets. So we still have a lot of place to win in terms of public health. They have a lot of opportunities for policies and interventions to actually provide health benefits. And even in some places in Europe where it is actually very good air quality. So, but as I mentioned before to you, this is not only air pollution. These urban and transport policies go beyond to air pollution. That is a typical risk factor, but there are much more than air pollution here. This is actually an intervention that happens in Barcelona, and this is a river that the city council decided to improve, and they clean the river, they put a nice grass, there's a lineal park, a bike lane, sidewalk, and ramps, so the accessibility improved, and the people start to use this intervention. So the intervention is to actually produce a better public space, open and green space, and access to the blue space. So this is good for physical activity. There you see a lot of people doing, maybe not a lot, but it's a very sunny day and it could be very hot in Barcelona. And there is not a lot of shade here, but there is still a lot of people that actually use this park. So this park goes 9 kilometers crossing the city and connect many municipalities. So this is a great opportunity to put an infrastructure to actually make more easy to do active transportation, walking and cycling, and maybe walking or cycling to work or any other destination to school. So we try to identify what will be the health implication of this specific urban park. We started to thinking, well, benefits of this kind of intervention, I mentioned to you physical activity, but there are other more type of health determinants that they are related with the urban parks is social interaction, green spaces, blue spaces. Maybe these green spaces also reduce their pollution, reduce the effect of the heat island effect, but and improve you are outside with this lovely sunny day, and then you're exposed to more UV radiation, you improve the vitamin D, but in the other side, maybe you also are riding your bike there and you fall, you have an accident, and maybe a crime, something bad will happen, and you spend a lot of time in that park. Maybe too much sun is not good for you. They're related with some skin cancer. So there are good and bad things of this kind of interventions, and we wanted to, in this case, to try to measure and translate that health impacts in terms of health outcomes. So for this specific intervention, we captured what is the amount of physical activity done in this specific park. We translate that physical activity to different health outcomes, in this case mortality, but also ischemic heart disease, stroke, breast and colon cancer, dementia. There are other health outcomes that have been related with physical activity, but until now we are unable to translate it in a quantitative risk assessment or health impact assessment because the evidence is not so clear, strong, or we don't have a good dose response functions. And finally, we translate that in cases of disease, disability adjusted life years, and economic evaluations. So we came with this data, we collect data to try to see, well, how many people actually use this kind of intervention, how often they come, what kind of physical activity or sport they do, for how long, if they're actually do it before this activity in other place, or there's a new physical activity performing this, try to see if they're adults, children, male or females. And we translate all of this impact, and you can see here that more than 5,000 users happen each day in that lineal park. And because the city is huge and the park connects different places in municipalities around the metropolitan area, So we quantify what actually that means in terms of disability adjusted life years. And this is a combination of morbidity and mortality, and try to give a sense of what is the overall impact, or in this case benefit, of the physical activity that is creating this new park, and also translated that in economic values. Overall, the benefit, we estimate that more than 40 million of euros per year can be some way saved, or can be estimated to reduce in the general society, because the promotion of physical activity of this specific park. So this is a lot of money, and this is something that benefits no one few persons, across the whole society. Another intervention we were looking is the open streets. The open streets is not actually an infrastructure, it's to take advantage of some public space and change the use. Normally you have here the ciclavia. So you have new activities that you can actually perform in the streets, and you can do cycling, walking. They have some classes of yoga and dancing. And we were approached by an NGO from Quito, from Ecuador, and this was a project of a citizen science project. This science shop where the not-profit organization can come to the university of the center, can knock the door and ask a question, and we provide advice, we provide scientific advice, and we try to run the project, model the study, and actually help them to answer the questions. And they have a problem at that time, that was last year. The new mayor of Quito wanted to remove the open street, because the mayor thought that there's a lot of money investing in that intervention, and actually there are not much more benefit that they can estimate, and it is good, but it only happens Sundays, and they thought that it will be better to remove that intervention and use that money for other things. So the NGO in this case asked us can you provide some kind of numbers, some assessment to see what are the implications or the possible benefits of the open streets in Ecuador, and translate that in economic costs, so we can some way justify that this is not only good for the city in general, it's good for health, because they're doing physical activity, but also have a meaning in terms of economical values. So we partnered with a network of open streets across Latin America. We collect data from 15 different cities across Latin America, 10 different countries, and we estimated what is actually the health implication of these open streets in those cities. We translate that in morbidity and mortality, and number of cases of disease, of prevented deaths, but also in economic costs. And this is the diseases that we include. We translate that in disability adjusted life years too, but this is actually the number that the NGOs and the network Open Street wanted to know. What is actually the economic benefit or health economic impact that have these open streets in the cities? And we came with $1.5 billion each year is the benefit in terms of mortality and their health costs for the physical activity performed in that ciclovías or open streets. So this is a huge benefit for the city and the society. And this is a way to actually support this policy intervention for the urban environments. And we came with different assessments for each city, and we provide a fact sheet for each city in Spanish, so they can actually use this information to the local authorities. So we came also to different assessment on other interventions. And this is, again, Barcelona. This is the public bicycles in Barcelona. The public bicycle systems are very common across Europe. China have a lot, Latin America, and now the US and Canada have a lot of this kind of systems. In Europe, they have a long history. They started in Europe, and in the case of Barcelona, now they're super popular, and they're actually one of the interventions that promote urban cyclists in the city of Barcelona. But in 2006, when actually the BICing, that is the name of the public system, came, they have a lot of controversy in the society. And there are many people calling that it's a wrong idea to put this kind of bicycles, because how do you want it to the people jump on a bicycle in a city like Barcelona that is highly dense with a lot of traffic, a lot of pollution, that you will be killed because you have a traffic accident. So maybe it's not a good idea to put this kind of bicycles, and the government should not invest in this kind of policies. So there are a lot of campaigns to try to go against this kind of system, and no one wanted to put these ugly bicycles in the beautiful city of Barcelona. So, and something similar happens also in Paris. So we went and tried to do an assessment. In this case, we assessed not only the health implications in terms of the physical activity, because you were jumping to a bicycle, and we compared those that actually were using a car and jumped to the bicycle and substitute the car trips by bicycle trips. And not only try to measure the benefits of physical activity, if not take into account the risks. Because it's true, if you drive 5 kilometers, the risk to suffer an accident or traffic fatality is less than if you actually ride a bicycle for 5 kilometers. So, and it happens in many cities around the world. So it's for kilometer travel, the risk is higher in the bicycle than the car to suffer a fatality. And actually, if you do a physical activity, you will inhale more air. And if your city is more polluted, have a lot of pollution, you will be exposed more to air pollution than be sitting inside a car. It's not because the air quality inside of the car is better, it's because you are not inhaling a lot, and because you're resting, you are not doing a physical activity, so your lung function and the liters of air that you are inhaling are less. So we try to compare what is the risk and benefits of this intervention. And we take into account these 3 health determinants. We estimated the relative risk, and we actually came with the overall estimation in terms of mortality. The general idea is like for each year, for those that actually jump from the car to the bicycle in Barcelona, to the public bicycle, 12 deaths can be postponed or prevented each year. So take into account the risk and benefits, and the benefits were 70 times higher than the risks. And the risk were fatalities from traffic accidents and air pollution. So at the end, we came with an answer to that question. Is it worth it to do physical activity in this kind of urban setting? And it is worth it, at least for Barcelona. So we tried to do the same exercise to different cities around Europe, and we made this assessment to 12 different cities where we had the biggest public bicycle systems in Europe, with more than 2,000 bicycles. In this case, we assess different type of public bicycles because they have the new generation of public bicycles. They have not only the mechanical bikes, they have also the electric bikes. And now with the electric bikes, we have also the concern in terms of, well, the people is driving a bicycle more fast, maybe the risk of traffic accident is higher. And plus, they are doing less physical activity because the bicycle is helping. So they are not getting the benefit of physical activity. So it is worth it to jump in an electric bike in an urban setting like any of those cities in Europe. And we assess more or less the same model and try to claim what is worth it, mechanicals, electric bikes in these European cities. And we found that we focus only in those cases and those trips that actually substitute car trips. Because one of the reasons to implement this policy is to actually reduce the emission, more sustainable, more climate mitigation, and improve physical activity. And this happened when you actually pull people from the cars to the bicycles. If you actually have your own bike and you just jump to the public bike, there are not more benefit. You are still doing the same physical activity, so nothing changed in your daily life. But if you actually move from a car to a public bicycle, then you have there a possible benefit. We then came with a tiny benefit, mostly because there are very tiny percentage of trips that came from cars in the public bicycles in these cities, but we still find it benefits that is worth it. Even the electric bicycles is worth it to do it electric bicycle trip versus a car trip in these cities. And we create different scenarios comparing with other cities where the number of trips, the substitution trips or between car and public bicycle were higher. And we can also risk and benefits. In this graph, you see where this line to your right, these bars are the risks for traffic fatalities, air pollution, and these blue lines that go to the left are the benefits for physical activity. In all cities, the benefits outweigh the risk. And you can see here the risk changes between the city because it's not the same to do cycling or physical activity in a city like Milan that the air pollution is so high, or Warsaw where the risk of traffic fatalities is higher. But the benefit also change because the distance are changing between cities. It's not the same to commute in Paris or Barcelona. The distance change, and then if you do more physical activity, more time, your benefit will be higher. So we have these beautiful romantic photos from Europe, and this is because we're thinking, well, it's not only cycling, it's also pedestrians. And what are the best gold standards for cycling and for walking in Europe? And this is, Paris is the gold standard for walking. 50% of the trips in the city are walking trips. And Copenhagen is the gold standard for cycling. 35% of the trips in Copenhagen are cycling trips. Then we try to see what happens if we go to that specific goal, so to that specific examples, and shift and try to see what happens if we translate that 6 cities to these specific active transportation scenarios. So we estimated what happens for Barcelona, Basel, Copenhagen, Paris, Prague, and Warsaw if they go to the scenario of Paris or Copenhagen in terms of cycling or walking. Try to send a message that what it will mean if we actually be like a Paris in terms of walkability and attract people to do walking trips, or what will be in terms of cycling if we will be like a Copenhagen. And try to translate that in terms of mortality, and that is the number of deaths that you can prevent each year in each of those cities if we achieve to that goal. And this is mainly because the cities actually tried always to compare with other cities. I tried to see, well, if Copenhagen can do it, I can do it too. So the mayors tried to push themselves and try to copy some good examples of policies. And this is one of the most common examples where the cities actually see themselves. And that's the reason we wanted to translate that in terms of health. So again, it's not only active transportation, not only walking and cycling, it's also public transportation. And this is the tram. This is tram in Barcelona. And this is actually the lines of tram that exist down in Barcelona. This is the sea, this is the mountain. And you see something grown here, like you have a nice lines here, you have a nice tram lines here, but they are not connected. For some reason, someone decided that not connect these lines. But the new mayor have a great idea to why we not connect the lines. And that will implies a reduction of 12,000 car trips that could shift from the private cars to the public transportation. It's a huge implication. So this just connected these lines. So they ask us can you provide a health estimate of what will be the implication of this public transportation intervention? And yes, we made an assessment similar to the previous in terms of mortality, and estimated for this 12,000 car trips reduction shifting to the tram. That will mean a reduction of 6 deaths. Why so small? It is a lot of trips. Because actually when you travel in a tram, most of the time they're not doing physical activity. You walk from your home to the station, to the tram station, and from the tram station to your destination. This is most of them 5 or 10 minutes walk. So the benefit is not so huge that doing the whole trip walking or cycling. Plus, you need to add the risk of these 5 or 10 minutes walking that you will inhale air pollution, but also you will suffer you could suffer a traffic fatality walking to the tram station. Plus, the benefit that the safest mode of transport in most of the urban areas is the public transportation. So you are very well protected when you are inside of public transportation in terms of traffic fatality. So we take into account this this small portion of the trips, and even we found that there's very small benefit, but still a benefit of health related with this public intervention. And we also came with other more common public intervention, and this is the bus rapid transit. The bus rapid transit is like a metro, but in the surface, and the bus rapid transit is more cheap than a metro, because actually you don't need to do a hole. You need to make a tunnels in the city. You can put a line and make it only exclusive for buses, and you create some stops, so the bus can go faster and that can be more or better controlled by the public transportation system. So this is very popular in many cities around the world, and we came with an assessment of 8 different cities around the world in terms of what are the implications of this bus rapid transit for those trips that actually are substituted by private car. So from those that decided to left the car and jump to the bus rapid transit, this is actually the health implications. And the bars means, again, mortality. And you see, for Mexico City, we have a huge benefit, mostly because in this case, the system is the biggest. And we have a lot of lines, we have a lot of buses in Mexico, so they capture a lot of population and they offer a very good network of public transportation. And we translate that in terms of economic values, and we see that 636 US dollars can be related as a benefit for these 8 cities for the bus rapid transit, that actually the trips that substitute cars. So this is a good message in terms of promote more investments in public transportation. And again, we figured out that this is not a walking cycle of public transportation. The real life is more complex than that. That this is one intervention actually push people to jump in different directions, and we try to make a multimodal assessment. And this is the case of Barcelona, try to combine cycling, public transportation, different scenarios of reduction inside of the core of the metropolitan area, but also between the different municipalities in the metropolitan area, that the trips are longer, or the distances they're bigger. So we came with different scenarios to try to estimate, well, what will happen if you reduce 20% of the car trips and jump into the bicycle, or combine that to public transportation in terms of mortality, but also life expectancy. So this is another message. This is not only the cities doesn't work with a single transport mode or in a single unit. The metropolitan areas are a combination of local authorities, and they need to work together, and we need to see the big picture. And then we came back to this framework, and again, we were not only air pollution, we were not only transportation that I mentioned to you here. Urban is more than that. And what more is like it's air pollution, it's physical activity, but it's also traffic noise. It's also green spaces, it's also heat island effects. When we came with a model straight, well, if we improve the whole city, at least in those 5 health determinants that are related with urban planning and transportation. And we came with this model. Again, we estimated the current exposure for Barcelona, for what will be the best scenario to improve air quality, traffic noise, heat island effects, access to green spaces, and physical activity, based on recommendation for the European Commission and recommendation from the World Health Organization. And we follow the same steps, estimate the exposure difference, identify different dose response function or relative risk from cohort studies and meta-analysis, and translate that to characterize the risk for our specific population. And this is the maps of Barcelona for air pollution. The darkest area are the areas with highest concentration of air pollution. Road traffic noise, this is the darkest areas are the highest areas with road traffic noise. Here you have green spaces, but in this point, the darkest areas are the areas with lack of access to green spaces. And finally, this is the map of heat island effects. And the darkest areas are the areas where it happens more often, the heat island effect. And we translate that in mortality in terms of what we reduce this exposure to improve these exposures. And we compare that, this is deaths per year that can be prevented or avoided if we improve each of those exposures. And you can see here that in terms of mortality, physical activity will provide the largest benefits. We estimate that also in morbidity. This is incidence cases, new cases of disease for these diseases. And in this case, we estimate that noise in terms of morbidity was more important, mostly because Barcelona is very noisy. Any intervention you do in traffic noise will be benefit the whole spectrum of the population, so everyone will be benefit. And we combine morbidity and mortality in disability adjusted life years, and this is the whole picture. And this was the first time that we compared these different environmental exposure and saw that actually, if we invest in policies to improve urban environment, specifically or prioritize road traffic noise, the benefit will be the largest for health, more than air pollution. Normally, we think that air pollution is very bad, but in this case, we identify that the benefit take into account morbidity and mortality, those cases that we can quantify. Noise looks very, very important, but the good news is that the policies for road traffic noise will be also benefit air pollution and many other exposures. We did a similar assessment in Bradford. Bradford is a city in the middle of the UK, it is still an industrial city. You can see here is very dense. And this is the map of Bradford. The darker areas are the areas with highest concentration of environmental risk factors. In this case, air pollution, road traffic noise, and lack of access to green spaces. This is a combined indicator. And the dots, the white dots, means where the more deprived groups of the population lives. And you can see here that actually where there are more pollution and more environmental risk factors are exactly the same places where the more deprived social groups are living. So in this case, we found that actually for Bradford works this idea that the people that is more socially deprived are suffering more for these environmental risk factors. And we try to compare that. This is the different quantities of deprivation index, and being the less deprived here, yeah, to the more deprived. And you can see here in terms of deaths, it is a ratio in terms of death of 100,000 persons. And you see in terms of PM 2.5, actually the more deaths are related in those more deprived, and that happens also for road traffic noise and access to green spaces. So interventions for urban environments or transport policies will benefit more to those that are more deprived in the city of Bradford. So which kind of interventions we can implement? And we have several interventions. This is the network of Barcelona. And they come with a great idea, and the urban planner of Barcelona say, well, what if we don't close the streets in the middle and make this small block a super block? So all this space here, they're exclusive for pedestrians, cyclists, and those corners are made parks. And they wanted to do that, remove all these cars here, and actually create beautiful parks here, open spaces, plazas, and make these pedestrians and cyclist areas. And this is something that already started. And this is the before, and this is the after of a super block in one neighborhood in Barcelona. And you see this is a very easy and cheap intervention. They just paint something, put some benches, trees, and the people start to use this public space. This is a permanent intervention. This is again the before and after intervention, the same street, and dedicated public spaces for other type of activities. And these have a lot of impact outside of Barcelona, and they try to see, well, what if we imported the idea to other places? And this is what actually the city wanted to do. And all these spaces inside of these lines are the super blocks. And they wanted to create more than 500 super blocks in the city, change completely the shape of the city, and to create more public spaces and reduce the space for cars. And we make an assessment what is the current Barcelona in terms of air pollution, road traffic noise, heat island effects, and access to green spaces versus what will happen if we apply the scenarios of super blocks in Barcelona. and improve all these environmental risk exposures. We quantify this in terms of mortality again, and we found that in terms of air pollution, the largest benefits of the superblocks will be focused on the benefits or improvements in the air quality, and that can be translated in health, but totally more than 600 deaths can be prevented, postponed, or avoided each year because of this intervention. And this is something that actually Quito in Ecuador wanted to implement, and this is the map of the downtown Quito that wanted to implement the same intervention. What is the next steps? Now we are working in terms of green spaces to try to improve the health impact assessment in terms of green spaces, try to put some explanation on how green space and health are related. We just started finishing a math analysis between green spaces and mortality, all-cause mortality and specific mortality, try to provide more robust evidence and applying this to a specific city, and this is Philadelphia, where the U.S. Forest Service asked us to help to do an assessment for different scenarios of tree canopy in the city, and we translate that in terms of mortality and economic evaluation, try to see these future scenarios, if they increase the greenness in Philadelphia, what will mean in terms of health and economic evaluations of health. We are working with the WHO to try to create these tools available for the stakeholders, so you don't need a person like me doing the analysis again and again, and you can download it online for free and do your analysis for your own city. I'm working also with the Pan American Health Organization, that's the WHO regional office for the Americas, working on green spaces, try to advise the local authorities in terms of green spaces, and we are looking for what is the future, and the future actually are happening in terms of transportation, in terms of autonomous vehicles. They're happening, and they're in a new intervention, and they're not so new. Just last year, just already started the Waymo One that is already working in Phoenix, and you actually with an app you can call a car and the car comes to you, and this is like an Uber, an autonomous that already exists. It's so more than 1 year running already, and we are trying to create a framework what that means for public health, how these are beneficial or how this can be a risk for health, how this can change our behavior, how we can change the urban and public space, and also create scenarios of what will happen, what is the worst case scenario. Imagine we have all the cars that are like this is a conventional car that is run by gasoline, and if you create more gasoline cars and you have an individual autonomous vehicle for you, you only are creating more problems than solutions. But you have the other extreme, maybe they're all electric, and maybe the electricity comes from sustainable energy or renewable energies, and you share these vehicles. So you have less vehicles, less emissions, and maybe will be good for health because you have less cars, less parking, and more space, more public space, maybe more green spaces, more social interaction. And everything in between could happen. We don't know what will happen in the cities, but we wanted to start to make recommendations for policymakers. We also work in terms of transportation and tools like this is the health economic assessment tool for walking and cycling for WHO. We just updated that in terms of methods. We include physical activity, air pollution, and traffic fatalities, so you can use it for free online, and you can do your own, crunch your numbers for your own city or neighborhood, and actually come and estimate the deaths and the economic evaluations. We are also creating these fact sheets, policy fact sheets with indicators that try to help urban planners with what I need to think when I'm planning an intervention in a city that actually is good for health, and try to make a checklist that say, do you think in terms of land use, the mixity, the connectivity, the walkability, the public space, the amount of public space, the amount of green space. So try to help the decision makers on this information. We wanted to move forward depending in technological transitions than a whole vision in terms of the model of the city. We know that we are just part of the management of the policies. We just provide evidence, try to communicate this evidence, but we don't manage the risks. Finally, this is Amsterdam. Amsterdam is very popular in terms of bicycles. There's a lovely public space, quite clean areas, but Amsterdam don't born with bicycles. Actually, Amsterdam was very similar to what the US is now, with a lot of parking space, with a lot of cars. So someone decided to move forward and leave this kind of urban environment and improve the city. So there is plenty of opportunities there. Just to let you know, I'm guest editor for this journal, and we are open to submissions in terms of health impact assessment. If you are working in this topic, don't hesitate to contact me. And after that, any questions from your side? Thank you.